frustrated, you don't even want to apply anymore. Rejections applying for jobs, for patient improvement, for patient research. One could get to a place where they stop applying for anything. How beneficial is that to anyone? I love this cartoon. I found this and I thought it's so perfect. A new medication's on the market, and you say, this will help people with this kind of condition, but it gets put on the market, the patients try it, and it doesn't work. Or it comes with side effects, or adverse effects that weren't even a part of the trials. Why weren't they part of the trials? Did the trial not apply to them? Of course it did. Isn't the research supposed to be for those who need the medication and different medical conditions that may adversely affect the new medication? What is patient-oriented research? It's research that focuses on the patient. It is evidence-informed healthcare. It starts with the initial studies in humans to comparative effectiveness and outcomes research, with the goal being integration of this research into the healthcare system and clinical practices, which then affects all of us. So my question is, who are the patients this research is focused on, and why isn't more of it being done? Ladies and gentlemen, honored guests, my name is Michel. I'm a patient and a caregiver. I'm a wife, a mother, a grandmother. I am a seamstress with a home-based business. I'm a trained legal secretary. I'm a trained medical transcriptionist. And I volunteer for many, many different things. 34 years ago, I had a pituitary tumor removed transplantally. Almost died twice in the first 6 months from adrenal failure. And not much later, CT revealed that my tumor had grown back. So 1 year after the surgery, I had 6 weeks of external beam radiation. In 2013, I had a meningioma removed that was possibly a result of the radiation. In addition to no longer having a pituitary gland, because it was completely destroyed by the surgery and radiation, I have many long-term side effects from the radiation. Some of these are, but are not limited to, long and short-term memory loss, which is why I have to write everything down. I have no hunger or thirst mechanism. I have very few taste buds. I have trouble sleeping. I have shaking of my legs. I have psoriasis of my gums. Trouble with my heating system. So if I take my jacket off, it is not from menopause, because I went through that 30 years ago. And my latest is I had to get hearing aids. After I had my meningioma removed, my neurosurgeon suggested I see a doctor who was doing a study in adults who had radiation as adolescents or young adults and are now experiencing long-term effects. I would say after 34 years, mine's long-term. After going through all 10 pages of the consent, and yes, I read everything, it's my legal secretary training, I came to the last page. One of the items is the consent to all my health care. All my records. My question is this really necessary to this study? I have no problem consenting to everything after the radiation. But previously, why is this beneficial? According to Wikipedia, informed consent is the process for getting permission before conducting a healthcare intervention on a person, I would hope if it's a person, or for disclosing personal information. It is part of the ethical clinical research as well, after having been informed of all aspects of the trial that are relevant to the person's decision to participate. I agree there needs to be informed consent to the patient, but who is going to inform the patient about all the questions being asked? I've attended conferences in Toronto on medication studies and research, and have asked the question, why are medications not being tested on patients who need them the most? If you're testing a medication that may help someone who has a pituitary issue or doesn't have a pituitary gland, doesn't it make sense to test on them? Or someone with migraines? Wouldn't it make sense to have patients with different conditions involved? When Imitrex first came out, my neurologist at the time was so excited because I'd been battling migraines for over 3 years. I was in and out of the hospital every 3 weeks with a migraine. Started vomiting, couldn't take my medication, have to go to emergency, get an IV, take my medication, and go home. Every 3 weeks. And I would wake up with the migraine, so I couldn't even feel it coming on. He was so excited with Imitrex. He wrote me a prescription and said I could take it in the middle of migraine and it would make everything go away. The part he forgot or didn't take into account is I don't have a pituitary gland. Imitrex, like many other medications, had no effect on me at all. Fortunately, due to his patience, persistence, and understanding, I haven't had a migraine for over 15 years. One of the diseases I managed to acquire, and no one can figure out how I got it, is Hep C. Fortunately, I was able to go on a newer medication to beat this. Unfortunately, the new medication came with a side effect that was not listed on the internet, and it was not listed on the pamphlet that came with the medication. What I did find is something that I think a lot of people miss. It says, if you have a side effect that is not listed, phone this number. So I did. Now I've done that on a few medications. I phoned this number that comes with the medication because they need to understand there are people like myself where either the medication doesn't work or it has a different side effect. How else are they going to know? I am also a caregiver. My daughter, who has come with me, has a lung disease. It's a rare lung disease called LAM, or lymphangioliomyomatosis is a really long medical name for it. Her lungs look like she's been a smoker since she was about 3 years old, and she's never smoked a day in her life. Down the road, she's going to need a double lung transplant. There is a center down in the States, a research center for LAM patients, to test medications and other treatments. The problem is, my daughter's not bad enough to go down for these treatments or to get tested. She spends a fair bit of time on a nebulizer. She has trouble sleeping. She has a cough that won't go away. Her lungs are getting worse and her breathing's harder, but she doesn't qualify. One of the nice things is finding a support group on social media. As much as people hate social media, there are definitely plus sides. Because you can find on social media a support group for your condition. I found one when I had Hep C. I had no idea what to expect, and this support group helped me immensely. You can talk to other patients who may be experiencing what you're going through for your treatment or your medication. You can ask questions that the doctors don't always want to answer to learn more. And I think the biggest thing is knowing you're not alone. When I was diagnosed with my pituitary tumor 34 years ago, I asked if there was anyone else like me, and I was told it was confidential and they couldn't share that with me. I felt very alone. Last year I saw a poster for a research study being done by a nurse who was looking for patients who had radiation for cancer treatments. I called her and I said, I had radiation for a very fast-growing pituitary tumor, and even though it wasn't the C word, cancer, I still had to have radiation. I asked her how these two were different. She said she never thought about it. And she said for that particular study, she couldn't accept me into the study, but she would definitely keep me in mind if she did it again. What is patient involved in research and why does it matter? Public involvement in research is research being carried out with or by members of the public, whereas patient involvement is to, about, or for them. Involvement is where people are actively involved in research projects and in research. Participation is where people take part in a research study, and engagement is where information and knowledge about research is shared with the public. I love this website. According to Canada's, SCORE has really helped me, and Canada's strategy, there you go, Canada's strategy for patient-oriented research. The goals of patient-oriented research are to improve health outcomes and enhance patients' health care through integration of evidence at all levels of health care. I think their name needs to be out there more because they focus on the patient. There are problems, and there have to be, or it wouldn't be healthcare, are getting the research from the labs to the patients. And we all know the patients are the ones that have to benefit. Another big hurdle, of course, is funding. I often joke and tell my doctors that I have a dollar sign on my forehead, because that's what a lot of it comes down to. Like a lot of things, when there isn't enough funding, patient-oriented research tends not to happen. The coordination of patient-oriented research needs to be improved. Clinical trials need to happen not just in the big cities, but in the smaller communities, because people have medical conditions there as well. When I had my pituitary tumor 34 years ago, I lived in Prince Rupert. For those of you who don't know, you look at the Alaskan Panhandle, you come straight down, you go straight over, and there's Haida Gwaii. They didn't know anything about my condition. My general practitioner at the time used to tell me it was a white elephant, that it wasn't the cause of my problems. There is an impatience with doctors, policymakers, and especially patients with the pace of discovery in new products or intervention. Who is it that decides what is a priority? Is my daughter not a priority? Does the squeaky wheel not still get the grease? Or does that not apply to patient-oriented research? Why aren't patients contacted to see if they'd like to participate in research? If it's patient-oriented, who decides on the patients? According to a website, Patient Involvement Clinical Research, Why, When, and How, it states there are often problems with recruiting or retaining patients. Then it went on to talk about requirements and that there must be an expert patient concept. If the information is available for the patient to participate in research, it seems the person or company doing the research needs to do a better job of getting that information out there. And would someone please explain to me what an expert patient is? They go on to talk about specific initiatives to engage patients in the research process, which come after identifying the research, leading and designing the research, improving access to clinical trials, getting adequate information about the study, assessing the patient's experience, and then informing the patients about the study. Looking at this from a patient's perspective, I think patients should be involved from the beginning. If it's research, we're doing it for the first time, so why is it called research? I am a patient. I realize the medication I take to live on is supposedly the best replacement medication for my medical situation. Should there not be updated patient-oriented research to see if newer medications might work better? Oh, well, it's working for you, so let's leave it. Medications that might help me to sleep or be able to lose the weight the cortisone has so nicely distributed around my middle. What about medications that may give me more energy? I have tried so many different medications to try and stop my legs from shaking, but nothing seems to work. And I just want it to stop. I don't have restless leg syndrome. I don't have Parkinson's, so is it caused from my pituitary gland? Where's the research? I am not my medical condition, but I would love to be part of any research that may help not just myself, but other patients with pituitary issues live just a little better. Living without a pituitary gland makes taking medication very interesting. I've been told by many physicians that I'm special. At least something about me is special. Having patient engagement, patient-oriented research is about collaboration. We are all a team. It is not doctors, nurses, patients. It is doctors, nurses, patients. We are all working together. The patients who get to be part of a research team often have a say in developing research questions and sometimes performing parts of the research. This ensures the research being conducted is relevant and valuable to the patients that it affects. Patients who are involved in research get to have a say in what is researched, and researchers get the benefit of the perspectives and experiences of the patient, and the healthcare system has access then to that research evidence that is needed to improve all our healthcare. Patients need to be first. 95% of our healing is our attitude. It's how you relate to what is being done. 5% is medical. It's that 5% that involves patient research to make those of us living with lifelong chronic medical conditions better. In April of this year, Minister of Health announced $81 million initiative to increase access to health research data. This is supposedly going to make it easier for researchers to access and analyze health research data. Is it going to make patient-oriented research better? I try to live each day to the fullest. I keep taking one step or one shuffle at a time. I know I'm never going to be better, but there has to be a way to help me feel better. I thank each and every one of you for what you're doing. I am not complaining. I wish that word was eliminated from medicine. I just wish patients were treated more like people than their medical condition. I wish that normal wasn't just a setting on a dryer. I want to work with you to make not just my health better, but those of my daughter, my husband, and many friends and family who have ongoing medical conditions. I am thankful for patient-oriented research. I just wish there was more of it. Yesterday was International What Matters to You Day. It is worldwide. I know what matters to me. Having my voice heard, being respected, and treated as a person. I now ask you, what matters to you? Every day and with everyone we meet, we should be asking ourselves, what matters to me? Not what matters to you, what matters to me that I can then share with you. Because I have asked my doctors that. I wear my t-shirt to medical appointments, to specialists, and they all say, what's that about? Well, let me tell you. What matters to you? Because I'll tell you what matters to me. I want to thank you all for your time and your patience. I feel strongly that by working together, we can all make a difference in our health. And I believe this is taken from SCORE, so I'd like to give them acknowledgement for that. I want you to know the first word, engages. The second word in the first word on the second line is focus. These are action words that involve the patient, not just in research, but as partners.